we have gathered to take our infant steps in yet another direction. The training of doctors for our country, for the nations of Africa, and for God's worldwide family. Let us all say amen, amen, let it be so. What did the early missionaries who brought the gospel to us see in the future of their projects? What did they envision as they opened schools and hospitals? Did Bishop Alfred Tucker look to the day when the training of African leaders for the church, as his vision was, would be a university such as UCU is today? Did Dr. Albert Cook see a teaching hospital as Memo Hospital has now become? Yet we cannot doubt that we have benefited much as a country. I cannot doubt that our all-knowing triune God, God the Father, God the Son, and the co-eternal Holy Spirit knew what he was doing through them.
So in September 1997, Uganda Christian University was born. Since then, the university has made its mark in higher education, not only in Uganda, but also indeed on the African continent. Students are coming from distant parts of the world, notably from Australia, China, Europe, in addition to the regular stream from the United States of America. Indeed, UCU is host to students from across the continent of Africa. To you, our guests today, we count on you for the success and sustenance of the UCU School of Medicine. I appeal to you, dear friends, and to all people of goodwill to give generous support to this school today and always. I want each of you to say, and I quote, "I am building a medical school for posterity that will transform health care wherever the graduates of the UCU School of Medicine will go."
We need more medical people in this country. More hospitals are being opened, both government and private, and the numbers of health workers have not been growing over the years, and more so for the specialists. Whereas we've been doing well with the first degree, we need more people specializing in the various fields of medicine. And so I want to urge UCU that having started the School of Medicine, also bring on board the specialties, because these go hand in hand with what you have started. We want to have more specialists spread out in the entire country, because we also need to ensure that our people get quality medical care and also curb on the number of people going abroad for treatment.
Why another medical school? And I summarize it this way: the Uganda Christian University School of Medicine can be characterized by the following C's. The first one is comforting, the second one is competent, the third one is caring, and the fourth one is conscientious. There are so many doctors in this country, but those four C's are lacking.
But what attracted me most was its Christian center, because it's a Christian-centered university, and it's one of the things which I really considered.
The graduates from UCU are hot cake. They are selling outside, and most of the top jobs in the country, they are being offered to them because of the kind of quality professionals that the university is producing.
Actually, in UCU, there is a complete education for a complete person. And in this is what I mean, that it makes you, the way they teach, the way the lecturers teach us, the way we are being handled, and the way we are being made to look at our profession, it's more than just being able to deliver physical medications to the person. It goes beyond that. It makes us feel that we can actually treat both physically and treat mentally, psychologically.
What are the needs of the UCU School of Medicine? I think they can be classified into 4 categories. The first one is human resource. We need more people who are qualified to teach in medical school and mentor students at all grades. The second one is learning resources. We need books, we need scholastic materials, we need laboratory equipment. The third one is infrastructure. There is a big need for us to find space to expand to, because as the years pass, the numbers of students and staff increase. And the last one, the software. We need a lot of collaborations with international organizations, both in the same profession and without. That would give us contacts for research, contacts for funding, and also contacts for community service. I think these are the needs of the School of Medicine.
I also thank the Church of Uganda for continuing the legacy of missionaries to offer social services, especially in the area of education and health. Actually, the missionaries that worked in Uganda in the health sector, many of them used to go through Mengo Hospital as the preparing ground for them to be able to fit in other areas of the country to practice medicine. So the training function of Mengo Hospital, in my view, has been on for a long time and is now just being formalized with this medical school. When you are training in medicine, really there's two main issues, three pillars that we are standing on in that area. You must make sure that indeed you are training people to practice medicine, but you also must make sure that apart from medical practice and training, there is also research. So we are expecting that the doctors that will be trained through this institution will not only excel in provision of medical services, but will also excel in terms of doing research. This will be consistent with the Uganda Christian University motto of Center of Excellence in the heart of Africa. I was also happy again to learn from the Vice Chancellor that the first class of about 65 students, you have 6 African countries represented. This is a great achievement and great recognition. And obviously, it is a Pan-African stance that we congratulate the university for, and this is very consistent with the political line of government and the movement to see that the African people work closely together to be able to solve their problems. We expect high-quality doctors to be trained in this university because of the tradition that the university has established, and that professionalism will be the key thing, integrity will be the key thing. And the country needs more and more doctors and more nurses, because the current ratio of doctor to patient is still low, and many of our people, especially in the rural areas, remain unserved because of inadequate manpower, which this university is going to cure. I thank you.
The psalmist confesses of this in Psalm 139, "Your eyes saw my unformed substance. In your book were written, every one of them, the days that were formed of me, when as yet there were none of them." God is working to fulfill his purpose through each one of us who is gathered here. You and I have gathered according to his will to support his venture.